Emotional and behavioral health issues quietly erode safety, productivity, retention, and culture, which makes emotional well-being a strategic issue for employers. In this conversation, the HealthNEXT team walks through the following 4 key points. How the EW55 assessment was built on 10 best practice pillars and a decade of research. How it scores emotional well-being on a 0 to 1,000 maturity scale. Why a true campaign must address the full health continuum, keeping well people well, reducing risks, managing acute and chronic conditions, and supporting complex care. And finally, the comorbidity between mental and medical illness and what that means for population health strategy.
When the emotional well-being assessment was developed on the framework of all of the research that we've done for over a decade that's generated the 10 best practice pillars, these shorter assessments are all scored with the idea of 750 being benchmark. And like our other tools, a perfect score is 1,000. And just like I mentioned earlier, when a few others on our team embarked on developing the EW55, we wanted to still do it based on the 10 best practice pillars. And so some of the things that are included in the EW55 are actually things that we know can impact emotional well-being, but are really, I'll say more typically accepted baseline factors such as encouraging physical exercise
Right.
and encouraging good nutrition and sleep. And when we looked at the gaps that still remain, they mostly fell into 2 categories, which was one was really around enhanced care management, and the other was really around engagement and navigation. So, as you would expect on the behavioral health side, trying to get people to take advantage of the resources that are available despite the stigma is a big part of this sort of improved engagement and navigation. And then on the flip side, just trying to make sure that the care that's there is delivered well. One of the things that really stands out for me is that 68% of adults with a mental disorder have a medical condition. 29% of adults with a medical condition have a mental health disorder. So it's pretty significant. And if you look at actually the hospital admitted population, the degree of overlap is even more remarkable. Something like 2/3 of people who are admitted to the hospital have a mental health issue in addition to what they're being treated for in the hospital. And so if you're trying to do something around behavioral health, one of the great ways to build out a comprehensive campaign is to look at each one of the pillars, right? So what can we do to make sure that we have leadership support and management alignment about behavioral health? What can we do to reinforce the data and analytics pillar as it relates to behavioral health? And what can we do to manage and integrate the vendor partners around behavioral health? That's often what we take the client through as we're trying to build out something very special around the campaign, in this case for behavioral health. We also try to make sure that we talk about the science of population health and well-being. So any kind of comprehensive campaign is going to do things to try to keep the well people well, in this case, resilient in terms of emotional well-being. And on the flip side, on the right-hand side, try to make sure that there's resources for people who are suicidal and everything in between. We're going to want to leverage the multi-channels of, I'll say, even marketing and communications. And we're going to want to leverage all of the existing partners, internal and external vendors. And when it's finished, you get something like you can see on the next slide. We're trying to answer the question, do we have resources and programming and benefits to, on the left-hand side, keep well people well, to reduce behavioral health risks, to manage acute behavioral health issues and chronic behavioral health issues and catastrophic behavioral health issues.
And so, we're trying to teach the campaign as being, really a very broad and wide thing that you have to put in place if you really want to succeed.
And perhaps anybody else that's willing to listen about what it takes actually to move a population in an impressive way with scale. And so you have to bring to the process a really mature and comprehensive approach to meet people where they are in the continuum and to deliver all of the potential services and programs with excellence.
As behavioral health and emotional well-being relates to brain health and brain economy. And so there's a lot of dialogue around neuroscience and how brain health is increasing performance, and employers want to figure out how they can take care of their employees and their brains so it benefits everyone.